Raywat Deonandan is an epidemiologist and associate professor at the University of Ottawa and a frequent guest on this program. He's with us again. Good to see you again, Raywat Deonandan. Look, what concerns you when you hear some provinces setting out some fairly aggressive reopening schedules here? What does that make you either concerned about or wonder about?
Well, my first thought is, are they gauged against indicators or are they attached to calendar dates? It can't be the second. It can't be arbitrary calendar dates that sound good to the people and allow people to plan. They have to be based on things like the epidemiological indicators, the population health indicators, and the hospital capacity indicators. And the second thing I think about is, are we sufficiently protected against the arrival of new variants that are quite aggressive? And by that I mean, do we have enough people with 2 doses into them? We're thinking about this summer as a 1-dose summer, but really we need 2 doses in a lot of people before we can start really thinking about aggressively opening.
Let's drill down on that a bit. People see the vaccination rates rising. They see new infections, for the most part, in most parts of the country, decreasing, and things starting to reopen and plans to reopen. But what do they need to know about the continuing presence of COVID-19 and the threat that it presents during those crucial reopening periods?
Right. So the cases are coming down. That's pretty obvious. We're probably pretty much past the peak of this third and hopefully last wave. Hopefully it is a last wave, unless we do something really stupid like open up too fast and too quickly. But the lagging indicators are going to be things like hospital usage. So our ICU beds are going to continue to be occupied for 3, 4, maybe even 5 weeks after the cases subside. And that's important because that space in the hospital is needed for things like movie filming in Toronto. Right. So if the stuntmen get injured, is there space in the hospital for them? So some things we cannot risk while there's no space in the hospitals. The second thing is, as I mentioned, the so-called Indian variant, B1167.2, is quite aggressive and hypertransmissible and is causing some issues in places like the UK. But 2 doses of the mRNA vaccine is at least 80% effective against it. And that's our way out of this. So we can't really accelerate reopening until we start getting 2 doses into a lot of people to build that level of community immunity. So that's a good rhyme, community immunity, yeah. So that we are resistant to things like this, so that we never have to close again. So the risk in my mind is, if we do this too quickly, we potentially have to do this all over again in the fall. Whereas if we do it right, we never have to close again.
Health Canada has said lifting restrictions should only occur once 75% of adults have had at least 1 vaccine dose and 20% are fully vaccinated. But most of the provinces are moving more quickly than that, and provinces seem to be setting their own rules for reopening. And you've sort of touched on it here, but how concerned are you about that approach? You're talking about some of the considerations we need to keep in mind as we do this, but some provinces seem to be working off a different set of rules.
That's their right. Healthcare, for the most part, is provincial in this country, and they understand their population and the burden of their disease better than anyone else. However, it's important to remember that this is a global issue, and it's a national issue as well. And what one province does affects other provinces eventually. Am I concerned that provinces are moving faster than the federal guidelines suggest? I am, because it's time now to err on the side of caution, now more than ever before, because we have this ramp to normal. Let's not mess it up.
So much of the emphasis for reopening is on vaccinations. But is that really the right measure, or is it just as important, maybe more important, to look at what's actually happening in each community in terms of infections and the strain on the healthcare system?
Well, the numbers are coming down for the most part, I think, because of the restrictions we put into place and also because things are opening up in terms of weather. But vaccination holds those cases down. So it's important to look at vaccination as the indicator that determines how we can open things up permanently. But as I noted, these other indicators are important. So I categorize them in 3 categories: the epidemiological indicators, the population health indicators, and the health systems indicators. The epidemiological ones are things like the incidence rate, the reproduction number, the test positivity rate. That tells us how far along the wave we are. And the population health indicators are the percentage of people who've been vaccinated. That tells us how resistant we are to further infection. But that third set, the health systems indicators, hospital usage, we don't talk about that enough. Right? And that tells us exactly how much we can play around in terms of opening up recreational activities in case people need their health services. So all 3 must be considered, not just one.
What's the right way to proceed in terms of, as these reopenings begin to take place, in terms of safety in workplaces, for instance, and stores and gyms as they begin to reopen, not just for the businesses and what they might be compelled to do, but for the people visiting them? What are some things to keep in mind?
Keep in mind that vaccination is not a perfect protection. It's fantastic, but it's not perfect. And the extent to which it fails determines how present the disease is. So the more prevalent the disease, the more likely it'll find holes in our defenses. As the incidence rate drops, then we can do things more flagrantly. So we have to keep these mitigation tools in place, like mask wearing and distancing and limits on gatherings, and lift them one by one as the summer unfolds and as the fall unfolds as well. We can't lift them all at once. So people have to remember vaccination is not a bulletproof solution. It's really good. It's not perfect.
Let's finish on this. Do you foresee at some point different sets of rules for people who have been vaccinated, fully vaccinated, and people who have not when it comes to things like access and restrictions?
I think so. We're going to see something resembling a vaccine passport for a while, but that passport includes vaccination, recovery from the disease, which is almost as good, and if you've had a recent negative test. So there's accommodation there for people who did not get vaccinated. That's important to consider. This isn't discrimination against the unvaccinated. There is a road forward for them. But there has to be a measurement, an indicator, a way to identify people who are less likely to infect the population if they enter a place of business.
All right, Ray Deonandan, always good to get your thoughts on these issues as we move to it seems like a different phase of the pandemic, hopefully one that leads to a full recovery of the economy and reopenings and so on, but lots still to consider. Thanks for your time tonight.
My pleasure.